Three guys walk into a clinic. Their legs hurt. What's wrong with them? I'm not gonna like you, am I?
Most likely cause of leg pain is muscle strain. Apply heat and rest affected areas.
Statistically, you're right. Very good. My experience, over half of leg pain is musculoskeletal, generally from excessive exercise. 12% is varicose veins brought on by pregnancy, and most of the rest is the result of vehicular accidents. I said 3 people. That's 6 legs. So you've got 3 hurt jogging, 2 in collisions, and 1 of the legs is pregnant.
What were they doing when pain presented?
I have no idea.
You didn't ask? You didn't take a history?
Of course. But all that told us was what they said happened. Person A, farmer, says he was fixing a fence. Puncture.
Snake bite.
That would be my guess.
Farmer didn't know he'd been bitten by a snake?
That's what he said. Sudden shooting pain, tall grass, never saw a thing.
What kind of snake?
You want me to tell you what kind of snake it was from the shape of the hole in the leg?
Well, how are we supposed to know what kind of antivenom to use if we don't know what kind of snake it is?
Oh, there are people to find those things out.
You have tendinitis. How old is this person? I mean, it's not really a 40-year-old man on the girls' volleyball team, right?
It's a leg. Leg is a leg is a leg.
Well, I was just worried that...
Did you worry about her more if she was younger?
Well, obviously, we should care about all our patients, no matter what age, what...
Yeah, right. I saw the way you were looking at Carmen. She's mine. Stay away. Would you operate on your mother?
Of course not. I'd be too nervous. Couldn't be objective.
Then why are you so anxious to treat every patient like their family? The actual patient is 16. Here's what happens when doctors care too much. Here's how a well-adjusted doctor handles a case.
Can I put my pants back on now?
I'd rather you didn't.
Which Carmen Electra is this?
First one, the golfer.
Then why isn't she wearing pants?
You have decreased reflexes in your patellar tendon. Anyone?
Slip disc?
Could be. How bad does it hurt?
It hurts really, really bad.
Yeah.
It doesn't seem real. Is she the one faking?
Oh, for God's sake. She's here to play into my fantasy, not because she's Meryl Streep. Fine.
The hell is wrong with me? Do something!
Too much pain to be a slip disc. Could be herniated and impinging the nerve root.
Or it could be referred pain from his groin.
Sir, are you getting pain?
He's curling, it's not the back.
Sir, where are you getting pain?
Me! He's not going to tell us anything if we don't get him out of pain. Give him 50 milligrams of Demerol.
We have no history. He could be allergic.
What do I do?
We can't diagnose him while he screams.
Better than killing him with painkillers that...
Apparently, he's not allergic.
Thank you. I feel a lot better now.
We screwed up.
No, you did exactly what his attending did.
And that was the proper way to handle the case?
Yeah.
The guy used him as a dealer.
You're going to see a lot of drug-seeking behavior in your practice, and there's a reason it works. Meanwhile, back on the farm,
Yeah, timber rattlesnake.
4 vials of the Crofab antivenom. Hey, how you doing?
all right.
Thank you. This will start making you feel better really fast. He's having an allergic reaction. Bag. Paddles and epi. His heart's fine. It's not gonna stay that way. Paddles!
The patient responded to epinephrine and the allergic reaction was arrested. Unfortunately, the patient continues to deteriorate.
Maybe the snake wrangler was wrong about the type we caught.
The faxus of venom test confirmed it's a timber rattlesnake.
No, it's not. Notice the volume?
I skimmed over that, and the gender and the coloring jumped right to the name of the snake.
200 milligrams. Our guy got bit less than 4 hours ago. There's no way a snake regenerates that much venom that quickly.
We're supposed to know how fast snakes make their venom?
Nope. Unless you got a patient bit by one, then it might be helpful. So what do we do now?
He must have been bitten by a different snake. We go back and find it.
Or you go online and you find there's only 3 poisonous snakes common in New Jersey: the copperhead, timber rattler, and the coral. Copperhead and timber rattler both respond to the antivenoms we gave the guy.
So we give him the antivenom for the other one.
Is that a question?
Well, we can't just blindly give him another antivenom, especially after the first one almost killed him. You said only 3 types of poisonous snakes commonly found in New Jersey. But what if this is an uncommon one?
Very good.
We gotta find the right snake.
No need. Odds are, by the time you get back, the autopsy results will tell you what kind of snake it was.
But you said...
So we do give him the antivenom for the other one.
Again, was that a question? I asked what you would do. It seems unfair for you to ask me what you would do. Who gives the guy the other antivenom? And who goes looking for the snake?
I assume that one choice kills him, the other one saves him.
That's usually the way it works at the leg turning black stage.
So half of us killed him, and half of us saved his life.
Yeah.
We can't be blamed
I'm
for...
sure this goes against everything you've been taught, but right and wrong do exist. Just because you don't know what the right answer is, maybe there's even no way you could know what the right answer is, doesn't make your answer right or even okay. It's much simpler than that. It's just plain wrong. We gave the guy the antivenom.
What if I'm allergic again?
That's why these people are here. If you have a reaction, we're ready to do whatever's necessary to ensure your airways stay open and your heart keeps beating.
My wife's on her way in. Can't this wait?
I'm sorry. Can't.
How do they teach you how to tell someone that they're dying? It's kind of like teaching architects how to explain why their building fell down. Do you role play and stuff?
Yeah, one of us gives the bad news, and one of us gets the bad news.
What do you have to do to get an A in You're Dying 101? They grade you on gentleness and supportiveness, sort of scale for measuring compassion. This buddy of mine, I gotta give him $10 every time someone says thank you. Imagine that. This guy is so good, people thank him for telling them they're dying. And it's brown. I don't get thanked that often. You're dying. In a few hours. There's nothing we can do except deal with the pain.
Well, I need to go home.
You're not going home.
But my dog. What will happen to my dog?
Her neck looks clean. No adenoma.
Wait. The guy's dying and all he cares about is his dog?
Any of you guys go the dog route in your improv sessions? It's a basic truth of the human condition that everybody lies. The only variable is about what. The great thing about telling someone they're dying is that it tends to focus their priorities, find out what matters to them, what they're willing to die for, they're willing to lie for. You must have a neighbor who can...
Neighbors don't like him.
So the Humane Society can take him in and find him a home.
No, they won't. Yeah, but maybe my aunt.
It wasn't a snake bite, was it?
I said I don't remember being bit.
Sure you do. Just not by a snake. I assume that Cujo bit one of your neighbors a while back. You tell me that he bit you, and I gotta report it. Cujo's got a record, he gets the chair. Trying to maximize the tissue, you say, also maximizes the chances of something going wrong, which means you gotta be extra careful, which is such a pain in the ass.
Amazing advances have been made. Kids with prosthetic legs are running the 100-meter dash in 12 seconds.
Yeah, just not as pretty. Do a bypass, restore the circulation.
Amputation is safer.
For you or me.
The blockage of blood flow.
4-day blockage.
Yes. It caused muscle cell death. When those cells die, they release cytokines and potassium.
If you restore the blood flow, instead of just lopping it all off, then all that crap gets washed back into my system. The cytokines could cause organ failure, and the potassium could cause cardiac arrest. On the other hand, I may just get the use of my leg back.
The post-operative pain alone.
I'll get through it. I understand the risks. You're in the clear. Go schedule an OR.
God, you're an idiot.
Yeah, I think I'm more of a jerk.
I'm not being glib. And I'm not being cute. I don't want you to kill yourself.
I'm not gonna die.
Oh, I feel completely reassured.
Inserting now.
They gotta hop that morphine.
Doctors say they can't.
Doctors recommended bed rest and antibiotics.
They screwed up. It doesn't mean they're wrong this time.
Sure doesn't mean they're right.
Morphine will kill you.
I can handle it.
You're in pain. You're not thinking right.
That's why I need the damn morphine.
I'll talk to them. Oh, my God.
Nurse. Nurse. I need more calcium gluconate.
You just had 5 mLs.
QRS is getting wider. My potassium is rising.
I'll talk to your doctor.
Well, you better make it fast, because I'm about to go into cardiac arrest. Give me the dose, or I go into white complex tachycardia.
I could get in trouble.
Listen, it's not a narcotic. I'm not looking for a buzz. You got about 20 seconds. What's wrong?
What do you got?
White complex tachycardia. You diagnosed it. Paddles.
Charge.
Clear.
The patient was technically dead for over a minute.
He's back.
Do you think he was dead?
you think those experiences were real?
Define real. They were real experiences. What they meant, personally, I choose to believe that the white light people sometimes see, visions this patient saw, they're all just chemical reactions that take place while the brain shuts down.
You choose to believe that?
There's no conclusive science. My choice has no practical relevance to my life. I choose the outcome I find more comforting.
Find it more comforting to believe that this is it?
I find it more comforting to believe that this isn't simply a test.
Incoming, another victim for the truck crash. Alice DeMarco, 52 years old, decreased LOC.
My daughter, she needs me.
Was she in the restaurant with you? Alice? Alice, she lost consciousness. She could be VTAC. Let's get her on 3. 1, 2, 3. 4 down on 3. 1, 2, 3.
Got it.
Cardio's right before intubation.
That's ready.
Let's get her on oxygen. I need 50 ketamine IV push.
200J, synchronized, charging.
Did somebody perform CPR on this woman?
The EMS said they found her with a pulse.
Okay, clear.
You should know that her heart stopped. Before the paramedics arrived.
Get him out of here. Let's intubate first.
What are you doing in there?
That woman, her doctor needs to know that her heart stopped.
Okay, now she knows, but the patients at this hospital are not your concern, all right? I need you to wait right here, get medical attention, and then get a statement to the police about the accident. Do you understand me?
CT is not looking good. He's fading fast. And check this out. I think he's got a...
There's an electrical disturbance in your mother's heart, which is causing it to beat irregularly. I just talked to her. Why is this happening to us?
It's not uncommon after trauma for the heart to...
Is it time for you to eat? You should be sleeping.
Oh. Does she have a history of heart disease, or is she on any medications you're aware of?
No. I don't know.
Okay. Well, we had to intubate to manage her breathing. She's in an induced coma while we isolate the cause.
Is my mother gonna die? She can't die.
We're doing everything we can.
You said her heart stopped in that restaurant. How is she even alive?
I'm still figuring that out, but the best doctor I know was there with her.
Those other victims were lucky Bishop was with them.
He needs a craniotomy to evacuate what's left of the hematoma and relieve swelling.
You think he gave himself a burr hole with a power drill?
For a blind shot, it's right where it needed to be.
I want to scrub in.
You're a trauma surgeon, June.
Got Dr. Bishop this far.
We don't need you, Dr. Curtis, but with your chief down, your fellow residents in emerge do.
Fine.
Code blue, trauma 1, code blue. You still need stitches, don't move.
Cardiac arrest. End tidal is good. Claire, let me know in 2 minutes or else we'll do a pulse check. Which one of you is monitoring this patient?
I was.
June, airway.
She's tachycardic. I was waiting on a cardiology consultant.
Get the ultrasound. Push 1 amp epi. At the pulse check, get that probe on her chest.
Got it. Okay, 2 minutes.
Hold compressions.
No pulse.
Cardiac activity, Mags?
I can't get a great view.
Still no pulse. What's the ultrasound say, Mags?
Okay, she's got a large pericardial effusion. She needs the fluid out now.
She's your patient, Mags. Get to it.
Never done one.
I have.
Do it.
I need a 30cc syringe and a spinal needle. We can put a drain in later. Ready?
Yeah.
Let's do it.
Hold compressions.
Thoracic cavity you're about to puncture.
I don't have fluid.
1 millimeter left. Almost there.
Got it. Getting fluid back now.
End tidal's climbing. Checking her heart. She's got output. We've got a pulse.
Good work. This patient has a serious underlying heart problem. Get to work before it kills her.
You're saying Alice DeMarco needs a heart?
I think the question is why you aren't.
Because we shouldn't jump to surgery. I mean, we don't even know why this is happening to her. If the cause is manageable, we'd be giving her a heart she doesn't need. That's crazy.
Yeah, I know you want all the data, but while you're waiting on cardiology, that woman nearly died.
Excuse me.
Hi, these are some forms for a transplant list, which your mother should be on.
My mother needs a new heart?
No, it's one option.
And we should get the process started because we can't control if or when she'll get one.
I don't understand what's going on.
Look, basically, your mother's heart isn't pumping strong enough on its own.
Because the trauma of the accident exacerbated an underlying condition. Who has legal say over your mother's medical care?
I don't know. My father died last year, cancer, 4 months after they found it. I don't know. I'm not ready for any of this. Not with the baby.
Okay, Emma. Emma, slow breaths. Calm down. It's okay. Slowly, that's good. Now look at me. There's still some tests that we can run before deciding.
If you think she needs a new heart, I'll sign.
And Alice DeMarco's blood came back negative for hemochromatosis, sarcoidosis, and amyloidosis. No sign of infection, viral or bacterial.
Then she does need a new heart.
Which would mean June was right.
Why can't June be right? Surgeons find
No,
surgical
I know.
solutions. That's what they do.
I think there's still something I'm missing. You can't leave me in this circus when your fellowship's over. Please.
I have a 9-to-5 clinic and my future and a wife and kids I wouldn't mind seeing more often.
Did you drill into my boss's skull? So you saved the others. I get it. I get it. You're a doctor. You're a very talented doctor, but also a reckless one who needs to understand that if my boss dies, they'll blame you.
There was no time to wait.
How could you know where to drill without imaging?
On the pupil asymmetry, the bleeding's almost always ipsilateral.
Almost always.
He'll recover from the drill if I was wrong, but not from the hematoma if it went untreated. It was a risk I had to take.
Do you know whose head you drilled into?
I know who Dr. Bishop is. Call the police if you like.
Why do you keep running away? Who are you? You were the first doctor to examine my patient, and her heart is failing. You tried getting through to me before. I didn't listen, but if there's anything else you've observed, I'm listening now.
She looked tired.
Yeah?
She wanted time to herself, and she's losing her hair.
Intelligent. This is the resting stage of hair growth. That could actually be brought on by hormonal surge. Emma? Emma, is this your mother's baby?
You didn't know? I thought I told that nurse. She was pregnant when my dad got sick. It wasn't planned. But she was so happy. And I wasn't.
Well, I think your mother has what's called a postpartum cardiomyopathy. It's a rare heart condition that can develop after having a baby.
Because of her age? It was too much stress on her heart?
No. It can happen at any age. And there was no way for you to know it was even a risk, okay?
I needed her after Dad died. But she needed the baby. And I wasn't supportive. I want to be. Please don't let her die. We both need our mom.
We're on it.
We need a doctor in the first-class cabin. Immediately. Is there a doctor on the plane?
How long have you had a cough?
2 weeks.
His veins are distended.
What's going on here?
I'm a cardiothoracic surgeon.
Do we need to land?
Hell no. I have a speaking engagement. You need to get me your medical kit and any other supplies you have. He has fluid building up around his heart. I'm gonna have to drain it. I'm gonna save your ass. You know, you took my seat without getting my outfit dirty. I don't have a change of clothes, you see. Don't worry, I've done this bunches of times, okay? Okay, glasses. Get a trash bag and tell all the passengers to throw any meds they have in it. Red, I need a vodka neat to sterilize my hands. Come on. And spray tan. I need something resembling a long needle. Okay, first class, who has a black card? Chopsticks? Thank you. Hey. Need something to cut him open with. It's titanium. Wow.
She was the first woman to train in cardiothoracic surgery
at Loyola University Medical Center. The first woman to complete a heart transplant fellowship.
Okay, napkins.
She recently became the Chief Innovations Officer at St. Matthew's Research Medical Center in Los Angeles, California.
Good morning, Frida. You look wonderful today. Are they still following me? Mrs. Rothberg had end-stage renal disease, one of the worst cases of IgA nephropathy I've ever seen, resulting in a complete shutdown of both her kidneys.
I didn't pee for a year.
And because this is St. Matthew's, where you lowlifes are lucky to intern, I was able to implant one of the first artificial kidneys into Mrs. Rothberg. The technology will blow your mind. It's kicking the ass out of kidney disease, and I'm kicking yours out of hospital. You're free and clear to go. And stand in line to the women's bathroom like the rest of us. Thank you. I'll miss you. Okay, we're gonna need a neurosurge consult on Mr. Parks. We'll have to peel that neurogenic tumor clean off his spine. That's gonna be an epic whack. And you tell those brain boys they're gonna have to let me use the new dual-headed dissecting microscope. Have you seen that thing? It's patient, Dina Monroe, has familial cardiomyopathy and advanced congestive heart failure. She's 29. Both her parents died of the same disease before they turned 40. I have to talk to her in private, so go stand in front of the OR board and learn how to sleep with your eyes open.
Full failure. Her systolic is
Give an
40.
Amphobepi.
Trace it down with an amp bicarb. Her sat's
I
dropping.
need to intubate soon. I need a MAC 3 plate and a 752.
What's the PTT?
She stopped breathing. Paddles! Charge to 360. 360. Clear! Charge to 360. 360!
We got a pulse.
What's her PTT? 36. Too low. Tell me the donor is cleared and get me that heart.
Right away, doctor.
Callahan, bag her.
Hey, what are you doing?
I want to do a heterotopic transplant.
What? Don't we all? That's not gonna
Her
happen.
pulmonary pressures are too high. If I do an orthotopic transplant, the donor heart will fail. It won't be able to pump against that kind of pressure. I can do this. I assisted on one during my fellowship.
Alex, there are 4 doctors in the world who know how to do this operation.
Now there'll be 5.
Pressure's dropping. I've got a lot of blood coming back at me through the suction, doctor.
Pledges.
A lot.
5-0, and get me some bio glue.
Bio glue, doctor.
Okay, walk me through this.
We're losing pressure.
Walk me through this, doctor.
This is delicate tissue. I want to load everything on the Castro to take the tension off the suture line. Because it's not going to hold. I'm going to put a side biter in the vessel to take the tension off so it won't tear more and stop the bleeding.
Bleeding's down. Pressure's up.
Still here.
I almost killed him.
Yeah, so do better.
Would you have let me kill him?
No. Another 30 seconds, I would have kicked you out of the OR.
Oh, so you were testing me.
Hell yeah. You want to be a surgeon? You better get a thicker hide, doctor.
A thicker hide or absolutely no capacity for compassion whatsoever.
This isn't personal.
Isn't it?
No. You asked me to teach you how to survive. You choked today.
Why are you always on me?
Because you got a shot at making him. If you don't screw it up.
Turn around. Please.
Doctor, we need to talk. You need to slow down.
I'm not your protege, and you're not my mentor. I'm gonna do this, Jesse.
You're making a decision before the credentialing committee has had a chance to approve.
We're using
Listen,
single cannulation stitches. No pledges, you got that? Uh-huh. My patient doesn't have time to wait for the committee to debate this.
You've been planning to do this from the minute that guy blew his brains out. I know you, Alex. You waited until now because you think the committee won't have time to stop you.
I'm chief of surgery, Alex. There's not a chance in hell I'll approve.
I'm not asking for your approval. And as Chief Innovations Officer, I no longer need it.
I suppose that's true now.
I'm ready to do this! Let's move! Marty, I need you to do something for me. I need you to tell Maggie what's happening to her sister. You tell her the operation will take 8 hours, and I'll do my best to send someone out there to let her know how things are going. Tell her I know what it's like to be sitting in this room, waiting to hear if everything's okay. Explain the procedure. It's called heterotopic
transplant.
Dina's heart will stay inside her. We'll take Thomas's heart and connect it on top of Dina's. Piggyback. The heart only knows how to beat, but sometimes it forgets. Thomas's heart will teach Dina's to remember. She will have 2 heartbeats for the rest of her life.
Give it to me, Pants.
No 2 hearts are alike.
I love it when she does this.
You're an idiot.
I want you.
Like snowflakes, every heart is frozen. How the hell am I supposed to defrost this? It's sterile. I'm just recycling the air in here. Lex got his heart where it belongs. The left pulmonary vein cuff for the recipient is anastomosed to the donor left atrium behind the interatrial groove. I need to somehow... I need to compensate here somehow for the size discrepancy. They're gonna line up. Doctor.
Pump flows are stable.
You got this, Pants.
Okay, walk me through this.
I don't need to. I got this. Just...
No, I mean, I'd like to know how it's done. Walk me through this, Doctor.
I'm gonna take a wedge out to add some length to the left atrial suture line so they match perfectly. The donor aorta needs to be shortened at the origin of the brachiocephalic trunk. I might need some graft material to bridge the vessels. They're not beating. Hearts aren't beating. The piggyback isn't working.
You've done everything right. It doesn't always work.
It's not over. You take me off pump.
Roger that, coming off.
What are you doing, Pants?
I need to restart the donor's heart. The VAD can sustain her for 12 hours. When you hit 2 liters of flow, restart the VAD.
5 liters, 4 liters, coming down to 3 liters, 2 liters, restart the VAD. I'm at 1 liter, flowing 500.
Internal paddles, 50 joules.
Off pump.
Charge. They just need time. They have to figure out how to be together on their own. She won't survive another transplant.